Hello, I want to talk to you about the implant. From the beginning, when we put the implant, I may open the gum and to see the bone clearly. In that case, I would put suture, so it has to be treated as an open wound, not to eat hard food, rinse it with Listerine, and eat soft food so the sutures won't come out. After we place the implant, we wait 3 to 4 months, then we start to restore it. Once we take the impression and send it to the lab and the crown is back, people think that, yeah, everything is done and we don't need to do anything else. And because now it's a piece of implant inside the bone and nothing going to happen to it, but it's not the case, because implant can get infected. Implant can go through two stages. One is mucositis, which is inflammation around the implant, or it can go through peri-implantitis, which is inflammation with bone loss. So the best treatment of mucositis or peri-implantitis, which would lead to failure of the implant, is to prevent it from getting there. How do we prevent it? By doing optimal home care. First, when we deliver the implant, patient should start chewing soft food with it to get it adapted. If we put too much pressure at once on the bone may react unfavorably. So for a couple of days, start eating with semi-hard food, and little by little go to hard food. Cleaning the implant is very important. We must prevent the biofilm. Biofilm is the material that goes around the teeth and implant for the bacteria to adhere and attack the teeth or implant. So after we brush, we should buy those interproximal, interdental brushes, small ones, interdental brushes, and we should dip that brush into Listerine and go in between the teeth, between the implants, and clean the area inside each side of the implant. We should be brushing with Colgate Total. Colgate Total has a material that also helps with the prevention of the biofilm bacteria. And the first year, every 3 months, you have to return to the clinic to take an X-ray to probe the case and to make sure that everything is okay. I recommend very strongly to buy a Waterpik, the model called Aquarius, that pressurizes the water and shoots it between the teeth and the implant and in between all the gum and the implant, and keeps it really clean and prevents it from the biofilm formation. So in short, start with soft food, then brush your teeth for 2 minutes with Colgate Total. Rinse your mouth with Listerine twice a day, one of them being right before going to bed. And every 3 month appointment to take an X-ray to make sure that everything is good. And after that, every 6 months to do a professional cleaning. Hope this will help you keep your implant for the rest of your life in your mouth. And I shouldn't say rest of your life, it depends how you take care of it, but I've seen implants 15, 20 years in the patient's mouth without any problem. And I've seen implant after 6 months, they have to be removed because of the bad oral hygiene and too much trauma and not following the direction. Thank you and have a good day.